Hello everyone, and welcome back to Health Diagnosis. Today, we're diving deep into one of the most essential nutrients for your body, a vitamin D, often called the sunshine vitamin. Even though it's small in size, vitamin D plays a massive role in keeping us strong, healthy, and full of life. But here's the surprising thing: millions of people, even in sunny places, are still deficient in it. So what makes vitamin D so important? Why are so many of us not getting enough? And what can you do about it? Let's find out together. Vitamin D isn't just another vitamin A, it's more like a hormone your body produces when your skin is exposed to sunlight. Once it's activated, it helps regulate calcium and phosphorus, the minerals that build and maintain healthy bones and teeth. Without enough vitamin D, your body can't absorb calcium efficiently, no matter how much milk or dairy you drink. That's why low vitamin D levels can lead to weak bones, fractures, or even osteoporosis over time. But vitamin D's job goes far beyond bones. It supports your immune system, helping you fight off infections and inflammation. Studies show that people with adequate vitamin D levels may have a lower risk of respiratory infections, autoimmune diseases, and even certain cancers. It also influences mood and brain health, helping balance serotonin levels, which may reduce symptoms of depression and fatigue. Have you ever felt more energetic and positive after spending time in the sun? That's your body responding to vitamin D. Now, let's talk about why vitamin D deficiency is so common. The truth is, most of us don't spend enough time outdoors. We work indoors, use sunscreen all the time, or live in areas where sunlight isn't strong enough during certain months. Even when we do go outside, our skin might be covered by clothes, or we may not be out long enough for our bodies to make sufficient vitamin D. People with darker skin tones, older adults, and those living in northern regions of the United States are particularly at risk because their skin needs more sunlight to produce the same amount of vitamin D. You might wonder, how do I know if I'm deficient? Some of the most common signs include fatigue, low mood, bone pain, muscle weakness, frequent colds, or slow wound healing. These symptoms are often overlooked because they can be caused by many things, but if you consistently feel tired or achy, it might be worth checking your vitamin D levels with a simple blood test. Healthcare providers usually measure your 25-hydroxy vitamin D level. Ideally, it should be around 30 to 15 nanograms per milliliter for most adults. So how can you increase your vitamin D naturally? Sunlight is the best source. Try to get moderate sun exposure a few times a week, ideally in the morning or late afternoon when rays are gentler. About 10 to 30 minutes of sun on your arms and legs can help most people maintain healthy levels. Of course, everyone's skin type and location are different, so balance is key. You don't need to burn to get your dose of vitamin D. If you can't get enough sunlight, the next step is diet. Although not many foods naturally contain vitamin D, some excellent sources include fatty fish like salmon, mackerel, and tuna, egg yolks, beef liver, and fortified foods such as milk, cereals, and orange juice can also help. Mushrooms exposed to sunlight are a good plant-based source too. Still, even with these foods, it can be hard to meet your daily needs through diet alone. That's where supplements come in. Vitamin D3, known as cholecalciferol, is the preferred form because it's the same type your body produces from sunlight and tends to be more effective than D2. The recommended amount can vary for most adults in the U.S. 600 to 800 per day is suggested, though some experts recommend more if your blood levels are low. Always check with your healthcare provider before starting supplements, especially if you take other medications or have medical conditions, because vitamin D is fat-soluble and can build up in the body. It's also interesting to know how vitamin D works together with other nutrients. Calcium, magnesium, and vitamin K2 all help vitamin D do its job. Think of them as teammates. Say without enough of one, the others can't perform effectively. For example, if you take high doses of vitamin D but don't get enough magnesium, your body may struggle to activate it. So it's always best to focus on balance rather than high doses of a single nutrient. Vitamin D's influence reaches almost every system in your body. Research links adequate vitamin D levels to reduced risk of heart disease, diabetes, multiple sclerosis, and even certain types of cancer. It also plays a role in hormone balance, fertility, and muscle performance. Some athletes supplement with vitamin D to improve strength and recovery, while others focus on it to support mental clarity and resilience. It truly is one of nature's most versatile nutrients. For children, vitamin D is vital for growth and preventing rickets, a disease that causes soft and weak bones. For older adults, it helps maintain mobility and reduces the risk of falls and fractures. For everyone in between, it supports immune defense, emotional stability, and long-term vitality. If you live in the United States, your vitamin D levels can fluctuate with the seasons. During the winter, sunlight in northern states may not be strong enough to trigger production, so supplementation becomes even more important. Some people worry about taking too much vitamin D, and that's a fair concern. Although toxicity is rare, extremely high levels over time can lead to calcium buildup in the blood, causing nausea, kidney problems, or other issues, so moderation and monitoring are key. Regular blood tests can help ensure your levels stay in the healthy range. Beyond supplements and food, lifestyle also affects how well your body uses vitamin D. Getting enough sleep, managing stress, staying active, and eating a balanced diet all contribute to how efficiently your body absorbs and utilizes nutrients. Healthy fats like those from avocados, nuts, and olive oil help vitamin D absorption since it's fat-soluble. So, pairing your vitamin D supplement or fish meal with a little healthy fat can make a big difference. If you ever feel the winter blues, low motivation, or constant tiredness, try to evaluate your vitamin D intake. Sometimes, improving this single nutrient can lift your mood, strengthen your immune system, and bring noticeable energy back to your day. Your body is designed to thrive in harmony with nature, and vitamin D is one of the purest connections between sunlight, food, and your overall well-being. In summary, vitamin D is more than just a nutrient. It's a foundation for health. It supports your bones, heart, muscles, brain, and immune system. It's produced by the sun, found in certain foods, and available in supplements. Yet, despite being so accessible, it's one of the most common deficiencies today. So take a moment to step outside, soak in the sunlight, enjoy nutritious meals, and if needed, talk to your doctor about testing your levels. A little awareness can make a big impact on your health. Thank you for watching Health Diagnosis. If you found this information helpful, don't forget to like the video, subscribe to the channel, and share it with friends or family who could benefit from knowing more about vitamin D. Stay healthy, stay informed, and remember, a good health starts with knowledge and small daily actions. See you next time on Health Diagnosis.